Hi, I'm Jenna Cameron with Mediflixx, and I have the pleasure of being here with Amol Karnick. He's the CEO and president of KA Imaging. Amol, thank you so much for the time. How's RSNA been?
It's been fantastic. We've had a great RSNA this year.
Great. What's the highlight been for you so far?
We've been introducing a new product. When you bring out new products, especially innovative products, you need some great clinical data.
Certainly.
So this last year, we've had some really good clinical data that validates sort of a lot of claims that we've had in the past.
That's
And
exciting.
that's really driving people and driving people's interest here.
Certainly. So you say you have a new product.
Yeah.
What new product do you have?
Absolutely. We call it Reveal. And it's like any other X-ray detector, but it has the innovation of 3 layers built into here.
Okay.
So it
this,
feels-
the idea is just
that's-
really
yeah.
just being able to take it with you. It's almost
It
like
goes in the system and take
Okay.
it behind the patient, absolutely.
Right. This is
It's
great.
not very heavy, it's
Yeah,
easy to
super
move
light.
around.
Yeah. How heavy is this? Like 5 pounds?
It's about
Maybe
7
less?
pounds.
Okay.
Yeah.
Great.
It's a spectral X-ray. It's the first spectral X-ray in the world.
That's exciting. Yeah, usually spectral, you don't see that tagged with X-ray.
No.
It's usually in like really big, expensive equipment.
Absolutely.
So talk to
CTs.
me about that.
Yeah, so what Spectral does, we've included it now as part of this mobile system. And what Spectral is, in a way like your eye can see 3 colors, we've done the same thing for X-ray. And that allows us to understand different materials.
So we're not
So-
just in black and white anymore.
No, we're not in black and white, but we can also separate and highlight different materials. Think about the chest wall. You got the rib cage doing a great job of protecting our lungs. However, it can make it difficult to interpret what's behind it.
Yeah, there's a lot going on there. So how do we see behind the rib cage?
So with the spectral capabilities, we can now separate the two. We can highlight only the soft tissue, or we can look at the bones.
So you can do both.
We can do both.
That's great.
Yeah, and the soft tissue, we're getting pneumonias, pneumothorax, lung cancer better than anyone else. In the bone, we can see fractures. We can also see calcification in the coronary artery, something no one else can do.
That's really impressive. And so how does that positively impact the patient?
Oh, absolutely. So we don't change the radiation dose. So we impact the patient by finding disease early at the same radiation dose, and same thing they would have done in the past. So you would have had an X-ray in the past, you would have walked away, potentially missing things, not seeing as much, and now we're giving that back to them. We can find disease. We all know that when you find disease early, you can treat it better
Certainly.
and more cost effectively.
Yeah,
So that's what we're trying to do, find disease early and treat it more cost effectively.
Beautiful. Well, that's a great mission. And it sounds like you're also increasing healthcare professionals' confidence.
Absolutely.
Is that right?
Absolutely.
Yeah.
There was a report last year showing the radiologist confidence can be lower. And we've actually done studies that show it would increase radiologist confidence on the readings. And then you can just move it, position it, and we can show some images as well.
That's great.
And
yeah.
we can show the images right here.
Yeah.
See this is a great case of, this was read as a normal image, but when we look at what we consider the soft tissue, there you can actually see there was a lesion behind. And there's a lesion behind the port right here.
Yeah.
So it was hiding pneumonia lesions.
Wow.
Yeah.
So yeah, you just really can pull back all those layers now and
Exactly.
see what you need to see
Absolutely.
confidently.
I think the momentum and the data that we've gathered in the last year and the information and the excitement we're seeing from the hospitals that are trying to work with us will allow us to really accelerate in 2025. Really make a big commercial impact, get more systems out there, treat more patients, help more patients, and make a difference in the healthcare system.
I'm excited just hearing all of
Fantastic.
that for you. I can't wait to come back and see you at RSNA in 2025 and see what kind of progress you've made.
Fantastic.
Yeah, you're already obviously making huge progress, huge waves, but I think next year is going to be even better for you as far as putting more machines in more hands and getting more patients served. So I
Absolutely.
can't wait to see that. Thank you so much for your time today,
Thank you.
Amol. I can't wait to see you next year, and I appreciate you so much.
Thank you very much.
Thanks.